My idea is just to quickly introduce the concept. In fact, I already circulated this in the, what we call, if you want, the concept paper in order to know where we are. It's just to set the tune and see some terminology that we are going to use. Okay, we have three elements in our debate today. One is global health, the second one is equity, and the third one is crisis. So we need at least to have a consensus on this terminology. What I'm proposing here is a definition which was elaboration of our group at Bocconi University when we tried to start with what is global health and try to bring one definition. There has been a very long debate about this. It's still ongoing in literature, but we try to bring together that debate plus what has been a long debate on this over the last 12 years in Italy. So this is our result and what we take for the definition of global health. What is important is interdisciplinary, and this explains also why we're trying to have really different, not only cultural backgrounds, but really technical or expertise background. It is not just a translation in a more fashionable term of what may be international public health or maybe just international partnerships. Everything is getting global now and everybody refers to global. For us, it is very important to understand what global means. And global means fundamentally going beyond what was in the past the authority of states, nation states, and their way to work together, international organization on the basis of international agreements, such as World Health Organization or the UN system at all. These are very, very important actors. We believe they are fundamental actors, these international organizations. However, we must recognize that there is something going transnational, means beyond those authorities, and therefore we have to understand how globalization has influenced this. And as a consequence, how this has been influencing health, and we recall the definition of WHO, to be sure that we are not focusing only on diseases, but we are looking at this wider complex situation of social and mental and obviously also the physical well-being. And therefore, having this idea of health, if you want health as a human right in mind, then as you see, equity is part of the definition. We cannot imagine to have health in a globalized world if we don't really try to have it in well distributed and responding to the needs of the populations. And this is not only for health as a result of the environmental factors of what happens in society, but also how we respond in recovering health eventually through care or preventing disease through other services. So it's health, and we will see how we manage the concept of health equity as compared with healthcare equity, which is obviously something else that is included in. So it's transnational issues, and also the institutional answers that come to this. The decisions which are taken in the World Health Organization or maybe taken in areas which are not health related, the World Trade Organization or the World Bank or the G8, any area which is taking decisions apparently or purely political or purely economical, but we know they all reflect on health. So it is to understand how these transnational factors really influence. And beyond those institutional actors that I just mentioned, if we think today that one of the biggest actors, at least in financing health in poor and disadvantaged countries, is the Bill and Melinda Gates Foundation, which is not even, is an individual structure, in fact. So an individual actor, it's just his family, let's say, we understand that we cannot deal anymore only with the classical institution. We have to understand. Doesn't mean we need to support that approach, but we need to understand who is playing a role here. Or the corporate sector is engaging more and more, not only through the business, but through really engaging in the governance process. And there is an enormous discussion now at the WHO about the reform of the organization. And the tendency is also to reduce the role of that organization, while at least this is a personal opinion, I believe it is very, very important to keep the normative role and really the normative authority, the authority of WHO at all levels if we want really to ensure public health. So, but finally, as we started this morning recalling the experience in Montana, so in a small community, the importance of all this global debate is not academic. It really reflects on the everyday life of the communities. And that's why we have to find this link. And obviously we have to work at the local level or at the national systems level. But if we don't understand that many of the things we can do or the impact on health of external factors, they depend on factors which are determinants, which are very far away. If we don't understand, even if we are medical doctors in the community hospital, if we don't understand the relation with those global factors, I think we may miss the real point. So that's about the definition of global health that I propose to you. From here, we go on identifying the difference between inequalities and inequities. Obviously, there is inequality is unavoidable, possibly. It is you have differences in distribution of goods, of services, of resources. But if you can prevent that inequality and you don't, then you are facing an inequity. So in fact, there is inequity introduces an element which is of ethical value. I mean, you really are in face of something you could prevent, a disaster that you could prevent, you do nothing, and therefore you are acting in a way which is not ethic. And this equity element, this ethical element is very much inside the concept of equity, and in that sense we prefer to speak of inequities rather than inequalities, because it introduces something that we could do and in fact we are not acting in the way to limit the damage. So health equity is, I was saying before also, it is a concept which is wider just to access. We discussed a lot another big debate today on universal health coverage, which obviously looks only at one aspect, at the aspect of how I can access to services and how this access is eventually made universal. But we are also interested to see how this interrelates with the rest of society, with social determinants, and that's why equity in health and the health outcomes is a wider concept, which obviously include the aspects related to health care. So it's good that we are here with people who deal specifically with health care, but we would like to keep in mind in our debate this wider framework of health as a human right, finally, which comes back continuously, and therefore looking at social, economic, political determinants and how they may be faced, how we can face that challenge. Now, this statement is taken from the Commission on Social Determinants in Health, promoted by the World Health Organization in 2008. And as you see, it is really showing the link with something which is deeper. It's not something which happens today. There are really structural issues in society that we need to understand. That's why when we were discussing of crisis, and this will be the next aspect, we didn't want to focus only on conflict areas or on the financial crisis that we are living through, this global financial crisis. We really want to go deeper and understand which are the structural conditions that may favor, or on the other side, we hope also limit these inequities in the world. And therefore, this brings us to look at a number of many different, this is not a complete list, obviously, but how we have to look into many different social determinants which are related to gender, education, environment, income. There are many different aspects that we have to keep in mind constantly and see the complexity. We tend today to look more and more only at one, due to specialization, due to our interest, to look at one. I'm looking at gender equity. I'm looking at the financial crisis. And the idea is that we need that interdisciplinarity, which was also in the first definition, to bring this knowledge, this expertise together if we want to understand the complexity of these factors and how these factors really interact among them. And when it comes to crisis, this definition comes somehow automatically from what I have said, because it brings really together any instability that we may have. As a crisis, maybe at the individual level, those who are medical doctors and clinicians know exactly what a crisis can be in terms of a disease which is evolving after phases of instability, but we can apply this on the community level, we can apply this on the institutional level, and we can apply this on a global level when we look at human society altogether. So here again, not only the specific crisis, but looking what is unstable and what made the system unstable. That's why we would like to look really into including the development model we are embedded in, the way it is, the solutions are presented. In phase of the financial crisis and more suffering is proposed to populations, I think we will have to see where we put this social floor, see how we can avoid that we use the same tool which has produced the crisis to correct the crisis. This is, however, this thinking cannot be applied only to the financial issues, may be applied to everything. I'm thinking later on we will discuss of the food system, and this is also has to do with how the model, I call it a development model in which we are embedded, this society is proposing, and if this is how this is related. Therefore, we come back to the three elements of our discussion: global health, equity, and crisis. And here I took this, statement from Naomi Klein, you know, the shock doctrine. I'm sure that many of you have read it. And she proposed that when there is a crisis, the crisis may be used, including to repropose certain kind of approaches which may just increase suffering. And like the terrorized prisoner who gives up the names of comrades and renounces his faith, you know, you are under crisis and therefore you leave all your defenses. So shocked societies often give up things they would otherwise firstly protect. And I'm thinking of the long way of humanity in defending human rights, the long way of public health people working for universal access to health services, to defending some social results which are really the results of fights, of battles, and there are, in the moment of crisis, you risk to lose all what you have been building for not only decades, I would say centuries, this is really the path of humanity. And sometimes humanity is in the crisis moment, in a critical moment, where it could just lose everything at once. And here we are to discuss together to see that we can prevent, to go maybe one step back, but not too many steps back, to prevent that really what is a crisis may be transformed in a catastrophe. And this is exactly what we want to discuss and how we can see it in different fields. So, as I said, the meeting, we will keep it now very informal. I give immediately the floor to Philippe Chastonnet, who will introduce us to this idea of human rights, health as a human right, and see how this completes the framework for the work of today.